A small study offers evidence showing a strange result of a COVID-19 infection during pregnancy, the risk of higher obesity for the child. Specifically, the researchers observed a pattern of U.S. women who gave birth to babies with COVID-19 at some point during their pregnancy and who had a lower starter weight and then lost weight much faster than other babies. Massachusetts General Hospital. Over time, obesity, diabetes and cardiovascular disease can increase risks in early life. The children exposed to mother COVID-19 shows that they have a change of growth.To effect on opinion immunitaire children. A lot research is still needed. Previous studies have examined effects COVID-19 on pregnant people and found that likelihood of serious illness is higher than COVID-19 pregnant people with non-pregnant people. But effects virus on baby are still unknown. In order to evaluate effects of COVID-19 on infants during pregnancy, researchers looked at his baby under 280, who was born during PANDEM before June 2021 at of Massachusetts General Hospital. Babies have not been included in the study if their mothers had a vaccine during pregnancy or if there is an uncertain vaccination. In the study, there were mothers narrowed with COVID-19 at some point in pregnancy. Approximately 130 babies were moved by mothers with non-COVID-free pregnancy. Researchers were at least 12 months old when they performed data collection and analysis. In study, most of the mothers contracting with COVID-19 had a slight illness in third 3-month periods. COVID-19 In-Undero, researchers, socioeconomic factors, mother age, ethnic origin and insurance, controlled aspects. Lower birth weight was related to lower birth weight.With mort weight gain. It was subjected to a virus associated with different patterns from the control group. The absolute difference in weight gain between those who are exposed to in-urero to the virus, but researchers say that a tendency is still open. It is not clear what effect this early gain will have for this child cohort and as a result, but the study stated that a lower birth weight and post-aftermath gain is risk factors for accelerated cardiometabolic disease. It is important to point out that this research has been restricted to the short period of time since the first relevant working group, so it be uncertain for a while whether this tendency will continue childhood or whether it find bigger studies. However, as countries leave behind public health measures, more pregnant people are exposed to COVID-19 and leaving unknown effects that require further monitoring and research in the future. According to the 2020 survey referred to by researchers, pregnant women made up about 9% of reproductive women with SARS-CoV-2 infection in the USA. Although the data were limited in Canada, according to an audience ruled by the University of British Columbia, there was at least 9,000 examples of a pregnant person who contract with COVID-19 in Canada. Together, these figures show that thousands of babies around the world may arise to parents who have virus at some point during pregnancy. Andrea G. Edlow, our findings emphasize importance long-term follow-up children exposed in utero, which are exposed to maternal COVID-19 infection and importance widespread implementation COVID-19 prevention strategies among pregnant individuals. There is a need for greater studies with longer follow-up time to verify these associations.